Hi, this is Jason Erickson. I just finished teaching a 3-day class on dermoneuromodulation, and there was a particular technique that I posted a photo of from a prior seminar, and a lot of people wanted me to shoot a quick video to explain it. And so what it is that a lot of times when people have discomfort in their lumbar area, anywhere from L1 all the way down to S1, S2, if they're supine, if the client is supine on the table, either because that's the most comfortable place for them to be, or in some cases the only comfortable place for them to be, I want to be able to address that area. And so while they're supine, sometimes it can be challenging to work on that area. So there's something that I found to be really helpful and fairly simple to do. So I have Christy here to be my model as my willing victim. And what I'm going to do is I'm going to start by sliding my hand under the small of her back, and I'm going to find where the spinous processes of her back are, so I know approximately where that is. I'm going to come off of that, and what I'm going to do is you can go ahead and let your arm rest down there, and I'm just going to palpate, and we're going to find out if Christy has any areas that are still a little grumpy after a couple, it's still a little bit tender there. Okay, perfect. So in this case, this tender area is about 1 inch or 2 off to the side of her lumbar spine, and it's about midway down her lumbar back. So at this point, I'm going to my fingertip, I was just kind of gently poking to find that tender spot. Now that I found it, I've stopped poking into it. I've just my fingers just barely touching the skin right where that spot was. At this point, here's the intervention. This is a really simple thing to do, but it's important to be aware of where her bones are. So if she's got her hip bone here, her ribs are here, I don't want to apply any pressure directly on those bones, but what I'm going to do is, almost like a karate chop here, okay, I'm going to find that spot between the bones, and I'm going to slide right across, and you're going to see her skin and her shirt is going to move, and what I'm going to do is that I slide in there, that's going to create a little gap for my elbow to tuck underneath her side. And this works really, really well, even with clients that are quite large. And once I get my elbow tucked under there, like a big old wedge, I'm going to wait about 5 or 10 seconds. And Christy, how does this feel when I press here now? Is that still tender?
No, it's better.
Okay, it's better now. Okay, so I could just hang out here. If she said, yeah, it's mostly better, but it still hurts a little bit, sometimes just rotating my hand out, almost like a little parade wave, I'll just turn it out, and sometimes that helps. That helps it even more. If I press here now, does that make any difference or not really?
It's better. It's
okay.
Yeah.
So it's still okay. So I could hang out here maybe 1 to 3 minutes, once in a while even longer, depending on how a person's responding to it. Okay. Now another option though, if I have a very large client, that would be my preferred way, but Christy is not a very large client. So when I have somebody like Christy that's a little smaller framed, fairly lean, I may not have a whole lot of tissue to tuck my wedge under. So what I'm going to do instead is take the top of my fist, slide it right into that soft area between the bones, and then I'm going to let my elbow drop. When that happens, her skin gets lifted up over the top of my fist. It's almost like putting a rock under a piece of carpet. And so now my fist just sits there on the table. I don't have to exert myself at all. And again, I could press on that spot. Is that still okay, Christy?
Yes.
Okay. All right. If Christy had said, no, that's not so great, I would have gone back to the other one. So this is a real simple technique that I usually call leaning on the table technique, because either I'm leaning on the table with my elbow, or in this case, I'm leaning on the table with my forearm. And either way, it can be really helpful for a lot of low back discomfort.